the health of our hospitals, next on Behind the Headlines.
This is Behind the Headlines, with behind-the-scenes analysis on issues affecting Pennsylvanians, sponsored by the Susquehanna Valley Center for Public Policy. Now, here's your host.
Welcome to a new edition of Behind the Headlines. We're here in Williamsport, Pennsylvania today at Susquehanna Health, and our special guest is the CEO and President of Susquehanna Health, Mr. Steve Johnson.
Good afternoon.
Thank you so much for having us here.
Well, thank you, and I look forward to our conversation.
Oh, well, I think you have you're in a fascinating area up here in Williamsport. There's a lot going on. Get a lot of notoriety on TV these days with Marcellus Shale. We'll talk about that a little bit later, but why don't you tell us a little bit about your background and how you ended up at Susquehanna Health?
Well, Susquehanna Health has become home for my family. I personally am from New Jersey. Okay. Came here to go to college, Lycoming College to be specific. Met my bride-to-be and ended up raising our family here and received my master's at Marywood University. I had a couple of different jobs, spent a little time in the service, ended up here at the Williamsport Regional Medical Center in 1984 as the Assistant Director of Personnel. Oh. And I've had a dozen different job titles, I suspect, between then and now, but I've been here ever since. So we've really enjoyed our time here in North Central Pennsylvania.
Sounds like you grew up here.
I feel like I grew up here in many respects.
Now tell us a little bit about Susquehanna Health. I know that there are more locations than just the facility we're in today.
Well, Susquehanna Health now includes 4 different hospitals. We have Soldiers and Sailors Memorial Hospital in Wellsboro, Tioga County. We have the Muncie Valley Hospital in the east end of Lycoming County, the Divine Providence Hospital here on the east end of Williamsport, and the Williamsport Regional Medical Center. And we have a variety of other services too located up and down the valley here, but those are the major hospital facilities.
Little satellite offices throughout the region?
Yes, yeah. Physician practices, insurance companies, etc.
And how many people do you employ?
4,000 people work here.
Throughout all 4 hospitals?
Throughout all locations,
That's
correct.
Pretty phenomenal. And how broad is the geographic region? Do you know? I mean, you sort of outlined it, but...
The primary market is Tioga County and Lycoming County, but we really consider ourselves serving each of the contiguous counties as well. So that's a total of 11 counties altogether.
Wow, that's a rather large employer in the area.
A lot of geography.
And
a lot of people, but in many respects, more geography than people in some areas. But
that's Pennsylvania, though.
That is Pennsylvania. And,
with agriculture as our mainstay, that's not surprising. So, now. Hospitals are always facing a lot of different challenges across the state, across the nation. Healthcare in general is always a really big issue. What are some of the biggest issues that are facing Susquehanna Health?
You know, here for us, the biggest challenge we have, I think, is dealing with the changes in the Accountable Care Act, the move from a volume-based business to a value-based business. Essentially what that's doing is changing the entire business model. So in addition to always keeping our patients first in all that we do, we now have to look for a different set of financial metrics upon which to base the business aspects of our organization's performance. So that change, I think, causes us, on the one hand, to have to be successful and effective inside of the old business model where volume is what drove the organization's business performance, and an environment where the outputs and the quality, efficiency, and cost equation drive the definitions of success of the organization.
Well, it sounds like that would be a big change from the way that hospitals have been run in the past.
It is a big change, and it's been described, in fact, as for leaders of an organization to have one foot on a boat, if you will, at a dock, and the other foot on the dock while the boat has been released and the boat is now drifting away from the dock, and we're trying to hang on and not fall in and be completely soaked, if you will.
Well, so we've outlined some of the problems. How is Susquehanna Health addressing the issues that you're facing? This one leg in one boat and one in the other. What do you have to do to address these issues?
Well, for us, we focused on quality as our #1 priority, and organizing ourselves around our patients and their needs first, and then assuring that the quality that we're providing has 3 major effective components. The first is clinical quality. So assuring good evidence-based service delivery. We have an outstanding medical staff focusing on all the right things when it comes to clinical quality. Secondly, we focus on assuring that the mechanics, the structural components of the organization, the facilities, for example, and the technology is all state-of-the-art and as good as it can possibly be. And then third, that our relationships with our patients are outstanding, and that patients want to be served here. They're loyal to the organization, if you will. It's really focusing, I think, the organization on those 3 aspects of quality, and then doing all that in a way that makes good business sense. That's been our focus, and to date, that's been the core and cornerstone, you might say, of our success.
It seems you can hardly walk into any hospital in Pennsylvania right now without running into some sort of construction or some sort of improvements even to the infrastructure, and you have the same going on here. Is that an ongoing challenge for you to keep up the look of the hospital and the facility?
It is an ongoing challenge.
How old is this hospital? I mean, that might be part of the reason.
Well, the medical center, Williamsport Regional Medical Center, is the oldest of all 4 facilities,
okay.
And it was established in 1873.
Oh, my goodness.
And at this location started, actually, in fact, the oldest building still on this location was built in 1923. So it's been here quite some time. The other organizations are about 50 years old apiece, and we've just concluded a major modernization and renovation and expansion program. When I say completed it, the new additions are complete, the renovations are complete. We have some destruction work to do next. We'll actually tear some old buildings down. That's the next phase of work. And then our plan is to always have something under construction or something under a major modernization or remodeling effort, so that we don't get behind again, so to speak, in terms of the caliber and quality of the facilities.
Well, and it's a competitive business that you're in too, so there's probably all that going on at the same time. Okay, let's talk a little bit about the federal government. I know that hospitals aren't always on good footing with the federal government and payments and everything, but tell us a little bit about what sort of challenges you have with the federal government, and then we'll talk a little bit about the state and the governor's budget coming up.
Well, the federal government changes, again, are principally driven through the Obamacare plan, the Accountable Care Act, if you will. Again, I think the plan or the concept of the Accountable Care Act had a lot of very admirable goals. For example, reducing the number of uninsured in this country, providing an insurance vehicle for the working poor, building a system that requires fewer cross-subsidies from other payers. Those are very admirable goals. The mechanics of how that's being deployed, on the other hand, and the sequencing and the scheduling of the changes in policy and procedure are very daunting, very difficult to manage, and we've spent a tremendous amount of time there. In fact, on a national basis, the federal government has stripped out about $150 billion from payments to hospitals and health systems for the services they provide, in return for a promise that there'll eventually be more coverage for these uninsured and underinsured patients that are frequently cared for at no charge now. All that's in transition. We're not sure how all that's going to work out, and whether the revenues associated with new patient volumes will actually materialize, or whether we've given up revenue in return for nothing. That's our concern right now, and managing through all this is a real challenge.
Well, now, part of the expansion of the Medicaid program and the Affordable Care Act, the governor was supposed to opt in or buy into the federal plan but chose not to. How are hospitals reacting to, how is your hospital reacting to the governor not going down that road?
Well, the governor's got challenges of his own. He's trying to sort through what the implications of this policy change are to his administration. And in that sense, thinking through both the short-term financial implication and the long-term financial implications are frankly the job that he should be focused on. And that's what he's doing now. Now, he's chosen, at least in the short term, to opt out and to allow the federal government to assume this responsibility themselves. The federal government's not really defined how it will do that yet, so we're really not sure.
And that's the governor's biggest criticism. How can we opt into something that we don't have any detail on?
That lacks so much definition.
Right.
Well, in some respects, welcome to our world, because that's what we're dealing with the entire Accountable Care Act. But that having been said, what we hope to be able to do over the course of these next several years is work together with the governor's administration to find ways to make the current Medicaid plan work and, as appropriate, expand that service or at least accommodate the federal government's program expansion in the Commonwealth.
So tell us a little bit more about the Medicaid challenges that hospitals face. Is that one of the biggest issues in terms of payment from the federal government?
Medicaid is the poorest payer of the federal government programs, and that's why it receives as much attention as it does. It's about 10 or 15% of our local business. It's more than that in some major metropolitan areas, and it's less than that in other more rural areas. But the fact is that the coverage for Medicaid recipients runs about 84 cents of reimbursement for every dollar spent. So that means that 16 cents of every dollar is a shortfall. And it really ends up being part of a charge structure or a negotiated contract with another payer. So somebody else pays for their own services plus subsidizes the services of those Medicaid recipients for which we're not paid the entire cost.
Governor Corbett recently announced his 2013-14 budget, and of course hospitals are impacted by that. If you could write a letter to the governor, what would you say about this year's budget? Or have you written a letter to the governor?
Not yet.
Not yet.
I would say, but if I was going to write one, which maybe is a good idea, I would say good start.
Okay.
I think...
you haven't felt that way over the last couple of years, I imagine, though.
That's true.
Yeah.
I actually think this is the best start of the budgets that he's put together, and for that matter of budgets put together by previous administrations. So I compliment him in that sense.
He could use that, so you might want to write a letter. So what in particular are you most pleased about?
Well, since we're talking about Medicaid, the piece I'm pleased with there is that the inpatient services provided under the Medicaid program are continuing to be funded at previous levels. And we had worked with his administration and with the prior administration to modernize the the Medicaid payment system. And we've designed a couple of unique components of that, which the governor has indicated a willingness to continue to support. That, I think, is a great accomplishment, and it sends a very good signal about the potential of working together to address other Medicaid modernization issues. And so that's why we're at least optimistic about the starting point.
Good. Well, let's go back to talking about you a little bit more. I understand that you are the chair-elect of the Hospital Association this year. Is that correct?
That's correct.
Congratulations.
Thank you.
Tell us a little bit about the Hospital Association first, and then what your responsibilities will be as the chair-elect.
Well,
if you know what they are so far.
You know, you never really know entirely what you're getting into when you accept these kinds of appointments. But for the sense that I have, I will share that with you. We have about 250 hospitals in Pennsylvania that are members of the Hospital Association. The Hospital Association is principally a lobbying and education organization. It works with the state government and the federal government around issues associated with the delivery of health care here in the Commonwealth.